The psychological effects of COVID-19 is universal, and very few population could be exempt from it. It is actually very common to experience stress and challenges to our psychological state, given the numerous changes and uncertainties that we have to face in COVID-19. However, the degree and severity of psychological reaction, such as anxiety and depressed mood, are highly heterogeneous in the population that could range from non-pathological condition to mood disorder level that would need help from the mental health profession. Research is still trying to understand the risk factor within, and children could be a vulnerable group. Although children and adults are alike in the sense that they both experience psychological stress during this period and could similarly suffer from symptoms of anxiety and depression, children could be a vulnerable group for several reasons. Firstly, the brain is still undergoing a lot of development, and their ability to cope or resilience may not be as mature as the adults. Secondly, they may be separated physically with the caregiver due to quarantine, hospitalization, or even death, which detach them from the major source of physical and emotional support. This is especially significant, as we know that early disruption to the attachment process of parent-child relationship may have detrimental effects on their psychological development trajectory and therefore impact on their long-term mental well-being. Thirdly, the societal impacts of COVID-19, such as on the economy, could interfere the family functioning as a whole. As children are dependent on the family, they could suffer greatly from both the actual limitation of resources in the family and also the intrafamilial conflict and stress. Healthcare workers are another vulnerable group, as they are challenged with so many uncertainties when the outbreak begins, witnessing critical patients and undergo stress due to risk of infection and fear of spreading the virus to their own family. The social isolation, long working hours, changing hospital guidelines and policies, and perceived stigmatization also aggravates to the psychological burden. Other than the common sleep disturbances, anxiety, and depression, they could also experience symptoms of post-traumatic stress disorder, which they may have flashback of the traumatic scenes, nightmares, hypervigilance, and avoidance symptoms. In a meta-analysis that was just published, it is estimated that close to 1/3 of the healthcare workers could suffer from various forms of these conditions.
Our recent study shows a surge in the number of psychiatric admissions since the COVID-19 pandemic. The number of older adults admitted because of behavioral and psychological symptoms of dementia was nearly doubled. This surge in admissions lasted longer than that observed in SARS back in 2003, was not explained by seasonal variation, and appears to be associated with reduced outpatient attendance and outreach services. Together with the suspension of group activities at the community centers and suspension of family members' visits in the residential facilities during the pandemic, the needs of those with dementia might not be adequately met by the level of care provided by the caregivers. The increase in caregiving stress might also result in lower level of tolerance towards the behavioral problems of those with dementia. Our findings highlight the negative impact of COVID-19 on older adults' mental health and the importance of maintaining care and support for this special population, as well as their caregivers, so as to reduce the risk of mental health deterioration and thereby the need for hospitalization. Low-income families are especially vulnerable to developing mental health problems during the pandemic. One of my master's students has conducted a study on low-income families and found that over 60% of our participants had moderate to severe depression, which is many times higher than that of the general population. Nevertheless, those who found meaning in life appear to be more resilient towards stress and have less depressive symptoms. Our findings suggest that strategies that help people from low-income families rediscover their meaning in life might be useful in promoting better mental health. While low-income families might be at greater risk of developing mental health problems during the pandemic, it doesn't mean that people who are financially sound are free of mental illness. One of our studies, which was conducted in the second wave of COVID-19, showed that people with clinically significant mental health problems are more likely to stock up on food and daily essentials during the pandemic, and they are less likely to give up social distancing even if the pandemic subsides. Our findings suggest that people who are mentally unwell might practice precautionary measures to a greater and longer extent, and highlight the importance of identifying mental health problems among those who might go too far with their safety measures.
When we talk about the symptoms that warrant professional help, we are looking for mood changes that are persistent in nature, that could last for weeks or more, and severe enough to disrupt your everyday functioning. You could feel that your mood could be low, anxious, or irritable, that you have much lower energy or motivation to handle your daily duties, or even to enjoy pleasurable activities. Sleep and appetites could be disturbed, and there could be a lot of ruminative thoughts that you cannot get rid of. The ability to concentrate on daily matters could be reduced, that your work performance is not as efficient as before. And sometimes one may also experience multiple physical discomfort, such as having gastrointestinal symptoms, feeling that your heart is racing, having headache, and worsening of existing pain condition. Common checklists that could be suitable for primary care usage would be that of PHQ-9 and GAD-7, which tap onto depressive and anxiety disorder respectively as a screening instrument. Also, your family and close friends may notice something different of you. If such changes are persistent and severe enough to affect you, do seek for professional advice. This is a topic which can be tackled at multiple levels, including policymaking and public health perspective, but I will focus mainly on the individual level. One key element that moderates our psychological well-being during this pandemic is our adaptability to the constant changes in the environment. We have to be aware of the factors that are jeopardizing our mental well-being, and at the same time, rather than focusing on what we are lacking of, we could shift our attention towards utilizing the limited resources that are still available to us. For example, we know that social isolation during the lockdown is causing a lot of psychological distress and a sense of loneliness. Yet over the 1 year in the past, there is a lot of creative usage of digital platforms that could allow us to overcome the physical barrier between individuals. Although the strategy is not perfect, and we are still hoping to get in touch with our friends and family physically, the strategy did mitigate partially the psychological distress. Speaking along the line, staying connected with people is also very important, as being able to talk about one's own feeling in a trusting relationship can effectively regulate our own emotions. Also, simple home-based physical activities could also improve the quality of our sleep, which is essential for mental well-being. And we can limit our exposure to potential sources of stress, such as by setting a reasonable limit to our screen time on news and social media and divert our attention to elsewhere.
Neuropsychiatric symptoms are unfortunately common among people infected with COVID-19, and it is important to note that many of them did not have any history of psychiatric illness. Examples of neuropsychiatric symptoms following COVID-19 infection include delirium, agitation, depression, anxiety, insomnia, and even psychosis. What is also important to know is that people infected with COVID-19 are twice as likely to develop neuropsychiatric symptoms as those infected with influenza and other respiratory tract infections. So this is another piece of evidence suggesting that COVID-19 isn't simply another usual flu virus that we could take it lightly. A cohort study consists of over 200,000 COVID-19 survivors published earlier this year in the Lancet Psychiatry show that 1/3 of them are still having neuropsychiatric symptoms 6 months after discharge. We are currently still trying to understand how much longer the neuropsychiatric symptoms will last after the COVID-19 infection. Nevertheless, given the large number of people infected with COVID-19 worldwide, the long-term neuropsychiatric sequelae of COVID-19 could potentially be another wave of public health crisis, causing serious impact not only to the individuals, but also to their families, to the healthcare system, and to the society as a whole. It is therefore important to prevent the spread of COVID-19 in the first place, minimize the risk of developing neuropsychiatric complications in those infected with COVID-19, and find ways to reduce disease burden in those who do unfortunately suffer from neuropsychiatric sequelae. Scientists are still trying to understand how COVID-19 infection leads to neuropsychiatric complications. Different hypotheses have been proposed to explain the underlying cause. But regardless of the underlying mechanisms, the most effective way to prevent neuropsychiatric complications is to prevent yourself from acquiring the COVID-19 infection in the first place. So protect yourself by adhering to the health advice recommended by your local health authority and by having COVID-19 vaccination. Having mental illness is not a contraindication for receiving COVID-19 vaccine. In fact, various studies show that psychiatric disorder is associated with higher risk of COVID-19 infection and COVID-19 related hospitalization, morbidities, and mortality. Some people with mental illness might have a lack of knowledge or awareness of COVID-19 vaccination. Others may have worries about immunization. It is therefore important to enable people with mental illness to make an informed decision about vaccination. And to achieve this, healthcare professionals could reach out to these individuals, listen to their concerns and engage with them, provide them with up-to-date information about vaccination, and address any misinformation so as to build trust, confidence, and acceptance towards vaccination.